Hey, welcome to this video by Creating a Family. I'm Dawn Davenport. I'm the Executive Director of Creating a Family. Today we're going to be talking about breastfeeding the internationally adopted child. First, let me recommend that you listen to the radio show podcast we did on breastfeeding and adoption. It was February 9th, 2011. We also have extensive resources on our website, creatingafamily.org, on breastfeeding. It's under adoption resources. You can find adoption. Just hover over the horizontal menu where adoption is, and it will drop-down menu will appear. Just click on resources and then go to the breastfeeding page. Well, the first question you probably have, is it even possible? And the answer is yes, it is possible. In fact, on the radio show, the February 9, 2011 radio show, one of the guests was a mom who had adopted a 7-month-old from Guatemala, and she was able to supply a full supply of milk to him and continue to nurse until I think he was 14 or 15 months old. So yes, it is possible. The likelihood of success depends on many factors. One, the age of the child. Obviously, the younger the child, usually the better. Also, the child's early feeding experiences makes a big difference. It is not at all unusual in international adoption for children to have, especially children who have been in orphanages, institutions, rather than foster homes, or in foster homes with a lot of kids, to have, we're feeding, the goal of the caregivers was to speed up feeding as fast as possible. So the holes in nipples were enlarged, and so that the milk will flow faster. Bottles are often propped. Things such as that make it less likely that your baby is going to want to work to get milk out of the breast. On the other hand, it is possible that your child may have had some early breastfeeding experience, which would also make it more likely that he or she would be familiar with nursing from the breast. Keep in mind that one of the main advantages of breastfeeding is bonding, not creating the full milk supply. So partly whether or not you succeed depends on how you define success, whether it means, if you think that it's meaning supplying the full milk supply, then you may end up being disappointed. But if your goal is to bond and have quality time with your child, then absolutely you should be able to succeed. One of the things you need to do is start as early as possible inducing lactation. We have got various resources on the breastfeeding page under adoption resources on protocols for establishing lactation. One of the decisions you're going to have to make is whether or not to utilize the lactation-inducing drug domperidone. It is controversial. There is no clear answer, or maybe there is a clear answer depending on what your opinion is and who you're talking to. We are not medical doctors. You do need to talk with your gynecologist and your pediatrician. We've done our best on that page to give you all the resources to help you decide, including the FDA, the U.S. Federal Drug Administration's warnings against using domperidone. So much to think about. Get the information and then make your decision. However, you do need to start early. Depending on the protocol you follow, it may be anywhere from 6 weeks up to 12 weeks in advance. And one of the main factors is going to be pumping. Use a high-quality electric hospital-grade pump with a dual attachment so that you can pump both breasts at the same time. Very important. Cuts the time in half, if nothing else, and also it is just a much higher quality. Whether or not you want to rent or buy, somewhat is going to depend on how long you're planning on pumping. Let's see. We have a lot of resources, by the way, on inducing lactation, including a video on breastfeeding the adopted child, as well as a top 10 tips for breastfeeding the adopted child, both of which give lots of resources and suggestions for inducing lactation. All right, so one of the first things you're going to want to do is immediately switch, or as soon as your baby has adjusted to you. I wouldn't do anything immediately. Let the child adjust. But as soon as the child has started to adjust, switch to a nipple it's a wide base nipple, more reminiscent of a breast, and with as slow a flow as possible, which means that the hole will be small. The goal is that your baby has been used to having to work very little to get milk out of the bottle. What you're wanting to do is make her work harder, get used to working harder so that she's more willing to switch to the breast. Next thing you're going to want to do is switch. If you were able to pump in advance and you have breast milk, or you were able to get breast milk donated, switch to breast milk away from formula. That gets the baby used to the taste. Now, you may not choose to use donated milk, you may not have donated milk, or you may not have enough pumped milk. If that's the case, if you have any pumped milk, just mix it with the formula. At first, I do recommend that you don't switch formulas for the baby when he or she first arrives, but after she's been home for a while, make the switch, get her used to the taste of breast milk. Next tip is hold the baby in a breastfeeding position when you feed him with the bottle. Gets him used to the position. Then, gradually, you're going to switch from the bottle to your breast. You will probably need to use a nipple shield, and you will almost certainly need to use a lactation aid, especially at the beginning. Maybe not, but most often you will. A lactation aid we discuss on a breastfeeding page of our website, but basically it is a tube leading from a bottle or milk supply. So when the baby is sucking on the breast, he also has the tube going into his mouth towards the roof of the mouth, and he will be getting some milk that way. We have a couple of videos on that page showing you a baby using a lactation aid while she's nursing. And then ultimately, the goal is to move away from the nipple shield, and then if your milk supply has developed, then to go away from the lactation aid. That may or may not be possible. If your child needs supplements, do use the lactation aid. Do not go back to, if you're determined to breastfeed, this is, don't go back to bottle feeding or cup feeding or finger feeding. You want to make sure that the baby is getting his milk from the breast, even if you're having to use a lactation aid, which is fine. Especially at the beginning, focus on skin-to-skin contact. Good for bonding, also good for the baby, good for the mom. Strip the baby down to her diaper and make sure that most of her is touching you while you nurse. It is really helpful to have a board-certified lactation consultant giving you advice along the way. This is not necessarily easy, and you need help. You may have a little trouble finding a lactation consultant that is knowledgeable about how to help somebody who has not been pregnant, who doesn't have the pregnancy hormones and things to have helped with the milk production. Contact La Leche League locally and ask who they would recommend. And if you don't have that, contact a lactation consultant at a nearby hospital and ask him or her who they would recommend. And remember that breastfeeding is more than actually feeding your child. It's the closeness, it's the bonding. That really is your goal. But if you decide that you are not going to be able to successfully breastfeed, or it's your child that was rejecting it, don't make that the end goal. There are lots of great ways to bond with your child. It doesn't have to be just this way. I hope this has been helpful for you. Thanks.